Assalamualaikum and very good morning to everyone. My name is Nurhana Hidayah binti Roslan. Today I would like to present my case study, which is the title is Dengue fever. As you all know, dengue fever has been on the rise in Malaysia over the past 40 years. The most affected regions in recent cases including Selangor, Kuala Lumpur and Johor. Malaysia health officials reported that more than 38,000 dengue fever cases through April 6 this year. Dengue fever. World Health Organization (WHO) said that some of 2.5 billion people are now at risk from dengue and estimates that there are maybe 50 million cases of dengue infection worldwide every year. Dengue fever is also known as breakbone fever, comes from associated muscle and joint pains. Dengue fever belonging to Flaviridae family. The genes is flavivirus. The main mosquito vector is Aedes aegypti. The virus are transmitted through the bite of infected Aedes aegypti that feed both indoors and outdoors during the daytime from early morning to sunset. These mosquitoes thrive in areas with standing water, including puddles, water tanks, containers, and old tires. Next, dengue viruses. There are 4 closely related but antigenically different serotypes of the virus that can cause dengue, which is DEN1, DEN2, DEN3, and DEN4. Each serotype provides specific lifetime immunity. All serotypes can cause severe and fatal disease. Dengue fever, marked by an onset of sudden high fever, severe headache, pain behind the eyes, and pain in muscles and joints. Some may also have a rash and varying degree of bleeding from various parts of the body, including nose, mouth, and gums, or skin bruising. Dengue has a wide spectrum of infection outcome, asymptomatic to symptomatic. Symptomatic illness can vary from dengue fever to the more serious dengue hemorrhagic fever that can cause death. This is the sign and symptoms of the dengue fever. First, fever, which is more than 39 degrees Celsius. Headache, muscle and joint pain, skin rash appear 4 to 5 days after fever, pain behind eyes, nausea, vomiting, and mild bleeding. This is my aim for this case presentation, which is I want to give awareness and improve the knowledge of the dengue fever process with clinical manifestations. Second, to develop an effective dengue prevention. Thirdly, to examine significant growth of dengue in public health. Okay, this is my introduction of the patient that having the dengue fever. Her name is Miss C. She is 15 years old, female, student. She is admitted in the hospital on 1st November 2018 from emergency department. From the clinical history, we can see that she having fever, feeling weak, lethargic with generalized body ache for 2 days. She denied vomiting, diarrhea, abdominal pain or bleeding tendency. She has no previous history of dengue fever, not from dengue area, and no recent fogging. She come to the hospital after she has been fever for about 2 days. Next, dengue fever. World Health Organization (WHO) said that some of 2.5 billion people are now at risk from dengue and estimates that there are maybe 50 million cases of dengue infection worldwide every year. Dengue fever is also known as breakbone fever, comes from associated muscle and joint pains. Dengue fever belonging to Flaviridae family. The genes is flavivirus. The main mosquito vector is Aedes aegypti. The virus are transmitted through the bite of infected Aedes aegypti that feed both indoors and outdoors during the daytime from early morning to sunset. These mosquitoes thrive in areas with standing water, including puddles, water tanks, containers, and old tires. This is the laboratory investigation for this patient. First, the hospital do the full blood count test. Second, dengue NS1 antigen test. Third, dengue IgG IgM antibody test. Fourth, liver function test. This is for the confirmation if either she's having the viral fever or not. Okay, this is the full blood count result on the 1st November 2018. As we all can see, all the result, there are normal result and not normal and not normal. From this, we can see that platelet count is low, which is 124 times 10 to the power of 3, which is low than normal range. The normal range is 150 to 450. The neutrophil reading is also a little bit high, 79%. The normal range is 50 to 70. Lymphocyte very low. Lymphocyte count is very low, 6% only. Now the normal range supposed to be 25 to 40. The monocyte little bit high, 15%. The normal range is 5 to 14. Eosinophil count 0, which is low. The normal range is 2 to 4. As we all can see from this result, she might be having viral infection from the platelet count and also from the neutrophil count. This is the result of FBC on 2nd November 2018. As we all can see, the white cell count suddenly dropped also. 3 times 10 to the power of 3. But the normal range is 4 to 11. The platelet count also become low than yesterday, low from the first result, which is 103 times 10 to the power of 3. The neutrophil also high, which is 76%. Lymphocyte count also very low, 11%. Eosinophil also, the eosinophil count also is very low, 0%. From this, we can see that yes, we can say that maybe she is having dengue fever because the platelet count suddenly drop day by day. This is a dengue NS1 antigen test. From the result of dengue NS1 antigen test, we can see the result is positive. NS1 antigen is a highly conserved glycoprotein that is present at high concentrations in the sera of dengue infected patients during the early clinical phase of the disease. Usually, the NS1 antigen is found in specimens from primary or secondary dengue infected patients between 1 and 9 days after onset of fever. So we can see that this patient is having dengue fever. Next, the dengue IgM and IgG antibody test. We can see from this, the dengue IgM antibody show the result positive, but the dengue IgG antibody negative. If the dengue IgM antibody show positive result, indicates that the specimen is positive for IgM antibodies to dengue. This suggests a primary dengue infection. If the IgG antibody is positive, it indicates that the specimen is positive for IgG antibodies to dengue. This suggests a secondary or past dengue infection. But from the result, we can see that only the dengue IgM antibody is positive, which is true that this patient is having the primary dengue infection. IgM usually become detectable until 5 to 10 days after the onset of illness in cases of primary dengue infection and until 4 to 5 days after onset of illness in secondary infections. In primary infections, IgG appears by the 14th day and persists for life. In secondary infection, IgG level rise for 1 to 2 days after the onset of symptoms and an IgM response is induced 20 days after infection. This is the result for liver function test. From this, we can see that the alanine transaminase ALT show the very high result, which is 71, which is 71. The normal range is below 31. For the aspartate transaminase or AST, also show the very high result, which is 330. The normal range is below 37. For the gamma glutamate transferase also show the very high result, 83, which the normal range is below 38. From all the laboratory result, FBC, dengue NS1, dengue IgG IgM antibody test and the liver function test, we can conclude that this patient is having dengue fever. Actually, for the dengue fever, there is no certain medication to treat the dengue fever, but to treat the dengue fever, we can give the patient intravenous isotonic crystalline fluid 5 ml per kilogram per hour for the first 2 hours, 3 ml per kilogram per hour for next 2 hours, and 1 ml per kilogram per hour for another 2 hours. We can also give paracetamol 500 mg tablet, 1 tablet every 6 hours. This is to reduce the fever. That's why to treat the dengue fever, we need to take a lot of fluid or water. This is the outcome of laboratory investigation. First, from the full blood count result, the white cell count, red blood cell, hemoglobin, and PEG cell volume show the normal result. But for the platelet count, neutrophil, lymphocyte, monocyte, eosinophil show the abnormal result. Basophil also show the normal result. Platelet count show low result, low due to dengue virus that induces bone marrow separation and it causes deficiency in blood cells leading to low platelet count. Neutrophil also show the neutrophil show high result, 79%. It is high because of infection from dengue virus. For lymphocyte, it shows a very low result. It is because of illness and immune response to take place. For monocyte, show high result. It is high because of infection and blood disorder from the dengue fever. Eosinophil show very low result, which is usually not a cause concern and actually it is quite common. From the dengue NS1 antigen, it shows positive result. Dengue NS1 is an antigen test which is test for dengue. It allows rapid detection of dengue virus on the first day of fever before antibodies appear after 5 or more days later. Next, dengue IgM IgG antibody test. The dengue IgG antibody show positive result. From this implication for the presence of IgM antibodies infection, and it is indicative of a primary dengue infection. presence of IgM antibodies can be detected 3 to 5 days after onset of infection. Dengue IgG antibodies show negative result, which is there is no IgG antibodies detected because no secondary or past dengue infection. The liver function test, alanine transaminase show high result. High LLT levels can give poor prognostic indicator of outcome in dengue fever. Aspartate transaminase AST shows a very high result, which is 330. It is high during early infection, especially within first week, and then declining to normal levels in next 3 weeks. This is the new application of new techniques and laboratory tests. First, polymerase chain reaction or PCR. Dengue virus can be detected in blood or serum of patients approximately on the first 5 days of symptoms. Real-time PCR has become a primary tool to detect virus early in the course of illness. PCR can detect the dengue RNA. The nucleic acid detection involves 3 basic steps, which is nucleic acid extraction, amplification of nucleic acid, detection of amplified product. After all the 3 steps are done, the products of the reactions are separated by electrophoresis on agarose gel. The amplification products are visualized as bands of different molecular weight in the agarose gel using ethidium bromide dye and compared with standard molecular weight markers. Lastly, dengue serotypes are identified by size of their bands. Second, MAC ELISA. This assay is based on capturing human IgM antibodies on a microtiter plate using anti-human IgM antibody followed by the addition of dengue virus specific antigen. The antigen used for this assay are derived from the envelope protein of the virus. Dengue specific antigens from 4 serotypes DN1, 2, 3, and 4 are bound to capture anti-dengue IgM antibodies and detected by monoclonal or polyclonal dengue antibodies directly or indirectly conjugated with an enzyme that will transform a non-colored substrate into colored products. It can be measured by spectrophotometer. Third, IgG ELISA. IgG ELISA is used for detection of recent or past dengue infections. This assay uses the same antigens as the MAC ELISA. In general, IgG ELISA lacks specificity within flavivirus serocomplex groups. Primary versus secondary dengue infection can be determined using simple algorithm in the IgG ELISA. From the result of IgG ELISA, it shows that samples with negative IgG in the acute phase and positive IgG in the convalescent phase of the primary dengue infections. This is my advice to avoid from having dengue fever. Actually, there is no specific therapy for dengue fever. Advise the patient to continue prescribed medications to ensure optimal recovery. Provide a clean environment such as mosquito nets when sleeping, and do not keep water storage without cover to avoid mosquito breeding. The patient have to increase fluid intake. Instruct patient to continue follow up with the doctor. Last but not least, please eat healthy foods such as fruits, vegetables, and meats. Thank you.